costovertebral and costotransverse joints are synovial joints. Adductor pollicis muscle is supplied by ulnar nerve, which is used for neuromuscular blockade monitoring. Rugoscopy is the study of rugae of hard palate. The triangle of Doom boundaries are very important. Medially bounded by vas deferens, laterally by gonadal vessels, apex at the deep inguinal ring. The right cardiac border is formed by superior vena cava, right atrium, and inferior vena cava. Straight branch of MCA, middle cerebral artery, Charcot's artery. The unlocking of knee is caused by popliteus, and locking of the knee is caused by vastus medialis. So these key points are extracted from PIQs and the GTs, 115 GTs. To get complete book PDF, WhatsApp on 87081872200. The muscle involved in swimming is latissimus dorsi. Then sternocostal surface of heart is formed by right atrium and right ventricle. The posterior tibial artery is located behind the medial malleolus, 2.5 cm anterior the Achilles tendon. The openings in diaphragm is very important. The T8 opening is inferior vena cava. T10 opening is esophagus or vagus nerve also goes through this. Then T12 opening is aorta, aortic opening, and thoracic duct and azygos vein also goes through it. Foramen ovale transmits the accessory meningeal artery. Foramen spinosum transmits the middle meningeal artery. Then anterior cerebral artery is a branch of internal carotid artery. So these are the key points of anatomy which is often asked, and there are many such points. So 115 GTs and every 20,000 plus points are available in the book. To get the complete book PDF, WhatsApp on 87081872200. And it contains 115 GT review, which includes PYQs of INICET and Neet PG. Okay, so and 10 key points of the clinchers which are often asked, by which you can identify the correct option. Okay, PG 26. So inverse stretch reflex is Golgi tendon reflex, which is disynaptic. The lateral superior olivary nucleus is responsible for detecting the direction of sound. Cerebral blood flow is majorly regulated by BP. Then H+ ions are responsible for sour taste. Serotonin is secreted by raphe magnus nucleus. Then GLUT1 is present in RBCs, GLUT4 in skeletal muscles, GLT2 in renal tubule. So perifascicular atrophy found in dermatomyositis. In cancer, there is a upregulation of muscle-specific ubiquitin ligase. If there are deposits of all Ig, IgG, IgM and C3, then it is known as full house effect, seen in lupus nephritis. If there are walled clusters of epithelial cells, then it is meningioma. Dural tail sign also seen. Then to outer giant cell seen in xanthoma, achondroplasia associated with macrocephaly. If you see intrinsic hand muscle affected frontal balding, then myotonic dystrophy is the answer. Then in fibromyalgia, there is tender bony prominence, increased pain sensitivity, glomus tumor pulsate vigorously and then blanches. Dalen-Fook nodule is a type for hypersensitivity reaction found in sympathetic ophthalmitis. In osteogenesis imperfecta, type 1 collagen defect is seen. In osteochondritis is most commonly associated with congenital syphilis. Ankylosing spondylitis, there is loss of normal lumbar lordosis. In osteosarcoma, the presentation will be ill-defined permeative bone lesion with cortical destruction. So all these points are taken from 115 GT review book, in which I have reviewed the GTs, 115 GTs including PYQs of INICET and Neet PG. You can get complete book PDF by WhatsApp on 87081872200. इस नंबर पे WhatsApp कर दीजिए, आपको बुक का PDF मिल जाएगा. बुक हैज़ 1800 पेजेस और इसमें 20,000 प्लस की पॉइंट्स हैं विच विल बूस्ट योर स्कोर इन INICET और नीट PG स्कोर. In Breslow second life test, stomach and intestine are tested. Pape's rule is applicable for blunt trauma to the skull and gunshots. IPC 197 deals with issuing false certificates. Section 85 IPC is responsible for criminal responsibility under forceful intoxication. Section 302 IPC is for murder. Adipose here is not seen in fetus less than 7 months of age. Rigor mortis appears from head to toe. Viscera preserved in poisoning case are stomach, small intestine, liver, gallbladder, kidney, blood and urine. So all these key points are taken from 115 GT review book. To get complete book, WhatsApp on 87081872200. Blowback phenomena is seen in head wounds. Then Gettler's test differentiate fresh water versus salt water drowning. In Rokitansky method of autopsy, urine situ dissection used in HIV, hepatitis B, and gonorrhea cases. Luke's abscess is the meatal abscess. Then Burns is blister with clear fluid seen in post-mortem burns, curling ulcer seen in ante-mortem burns, raindrop pigmentation seen in arsenic poisoning, arcing of the back seen in strychnine poisoning.